Hello and welcome to KCS Connects. I'm Jack Miller, one of the co-directors of Key Clinical Skills. KCS Connects is our way of helping connect you to literature that we believe will significantly improve your clinical practice. This edition of KCS Connects looks at a paper published in Musculoskeletal Science and Practice in 2021, and the research was done by a group of researchers from Denmark. And what they looked at is they found that less than half of patients in secondary care adhere to clinical guidelines for subacromial pain syndrome and have acceptable symptoms after treatment. And this is a national cohort study of over 3,300 patients. Now, a little bit of background here is that, first of all, there are evidence-based guidelines for the management of subacromial pain syndrome do recommend exercise as a first-line intervention, and along with that, supplemental interventions, including manual therapy. However, we also appreciate that other research has shown us that patient compliance to exercise can be as low as 17%. Now, the graphic over on your right-hand side looks at some of the issues regarding patient resistance to self-management, and that can include lack of knowledge, ability, effective skills, motivation, lack of buy-in, and often the new behavior is perceived as less effective or rewarding as its alternatives. Now, this particular study was a Delphi study of, again, over 3,300 patients, all who had subacromial pain syndrome, and they were recruited from any of the hospitals in Denmark. And the exercises that they were given included a home exercise program in 94%, individual treatment sessions in 73%, and a group exercise program in 16%. And the focus of most of the exercises were either strengthening or mobility. Now, what they found here is that, only 45% of patients actually completed the entire 12-week exercise program. Now, those that did complete it had a much better outcome, as seen on the graphic on your right-hand side. But again, less than 50% complete that program. So let's be honest here. First of all, we should acknowledge that there is no published evidence that regular return visits to physiotherapy or the use of manual therapy creates what people often describe as patient dependence. Despite its belief to the contrary, there is no published evidence. And our apologies to Drake there, that graphic on your right-hand side. This is the physiotherapists, and the top one is our response to having a patient actually come back for our return visits. Whereas the bottom graphic is our typical response for having a new patient come to us, isn't it? So again, let's take that down. Having a patient come back to you on a regular basis for booster sessions does not create dependence. You're not doing them harm. In fact, you may be doing them some good. We know that patient compliance to duration of exercise is a challenge to you, okay? We also appreciate that there is good research out there to suggest that regular booster sessions of physiotherapy has been demonstrated in other musculoskeletal conditions to improve outcomes. And we recommend that you consider bringing your patients back on a regular basis in order to progress and monitor their exercises and augment that with appropriate use of adjunctive interventions such as manual therapy. If you'd like to learn more about this particular study, come visit us at www.keyclinskills, where we've got a complete review of this particular paper. You can also access our entire library of research reviews, and that's a great tool for you to use in your clinical practice. Hope this has been of value to you. Thanks for your time.